If you're over 60 and your doctor just celebrated getting your blood pressure down to 120/80, you need to hear this. A study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 years, and what they found contradicts everything we've been told about blood pressure targets. The seniors with so-called perfect blood pressure had a 28% higher risk of serious falls, and their mortality rates were actually worse than those with moderately higher numbers. In the next 15 minutes, I'm going to show you the exact blood pressure range associated with the longest survival in older adults, why the standard target might be dangerous after age 75, and the one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. Ken Dahl, and this information could genuinely save your life or the life of someone you love. Before we go further, drop a comment right now with just your age, nothing else. I want to see who's watching this because the information I'm about to share applies differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. This is critical information I need to see, and you'll understand why in about 3 minutes. Here's what's happening in doctors' offices across the country right now. A 78-year-old comes in for a checkup. Blood pressure reads 145/86. The doctor pulls up the standard guidelines on the computer screen, sees that target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next 6 months, that blood pressure comes down beautifully, 124/78. The doctor is pleased. The patient gets a gold star on their chart. Everyone thinks this is a Sutkow story, but here's what the guidelines don't account for. That same 78-year-old now stands up to go to the bathroom at night, and their blood pressure drops from 124/78 down to 88/56 within seconds. Their brain isn't getting enough blood flow. The room spins. They reach for the wall but miss. And suddenly, we're not talking about blood pressure numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in rehab, and a cascade of complications that too often ends in loss of independence or worse. The research published just months ago in JAMA Internal Medicine should have made headlines everywhere, but most doctors still haven't seen it. Most patients certainly haven't heard about it. And that gap between what the research shows and what's happening in everyday medical practice is costing lives. Here's the part that's going to sound counterintuitive, and I need you to stay with me because this is where everything changes. For decades, the mantra has been simple: lower blood pressure equals better health outcomes. And for middle-aged adults, people in their 40s and 50s, that's largely true. Getting blood pressure under control in midlife prevents heart attacks, strokes, and kidney disease down the road. The evidence is rock solid, but something fundamental changes after age 75. The research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. Your cardiovascular system at 75 is not just an older version of your cardiovascular system at 45. It's fundamentally different in ways that change what blood pressure numbers mean for your health. Let me explain the 3 critical changes that happen with aging. First, arterial stiffness. As you age, your arteries become less elastic. Think of a new garden hose versus one that's been out in the sun for 20 years. The old hose is stiffer, less flexible. Your arteries undergo a similar process called arteriosclerosis. When your heart pumps blood into stiff arteries, they can't expand and absorb the pressure wave the way young flexible arteries can. This means you need slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys, especially when you're standing upright. Second, baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels that detect pressure changes and instantly signal your brain to adjust. These become less sensitive with age. They respond more slowly. So if your baseline blood pressure is already low and your baroreceptors are sluggish, you get that dangerous drop in pressure when you stand. Third, medication metabolism changes. Your kidneys and liver don't clear medications as efficiently at 75 as they did at 45. Let me tell you exactly what this recent research found because the specifics matter. The study followed 15,342 adults over age 75 for an average of 5 years. These weren't hand-picked healthy seniors. These were real-world, older adults with diabetes, prior strokes, heart disease, and varying levels of frailty. They divided participants into groups based on their systolic blood pressure. Here's what they found. The lowest mortality rate was in the group with systolic pressure between 130 and 140, not below 120, not the textbook perfect number, the moderate range. Those with pressure below 120 had a 28% increased risk of serious falls requiring hospitalization. They had higher rates of acute kidney injury, meaning their kidneys couldn't function properly with the lower pressure, and their overall mortality rate was 14% higher than those in the 130 to 140 range. The group with pressure above 150 also had problems, but the surprise was that very low pressure was just as dangerous as very high pressure. The sweet spot, the range associated with longest survival and best quality of life, was higher than conventional guidelines recommend. Picture this scenario. You're 76 years old. You walk into your doctor's office for a routine checkup. Your blood pressure reads 142/84. Your doctor looks concerned, pulls up the guidelines, and says, "We need to get this down to at least 130, ideally closer to 120. You're started on a medication. 2 months later, your pressure is 128/78. Your doctor is pleased, but suggests adding a second medication to get it just a bit lower. Another 2 months pass. Your pressure is now 122/76. Perfect, your doctor says. You feel fine at first, but then you start noticing something. When you get up from your chair to answer the phone, you feel momentarily lightheaded. When you stand up from the dinner table, there's a split second where the room seems to tilt. You mention this to your doctor, who says it's probably just age-related. Just stand up gradually. But what's actually happening is that your blood pressure, which looks great when you're sitting still in the doctor's office, is dropping dramatically when you stand, from 122/76 sitting down to perhaps 95/60 standing up. Your brain is experiencing repeated episodes of inadequate blood flow. You're at high risk for a fall, but nobody's checking for this because your sitting blood pressure looks textbook perfect. Here's what's shocking to me. There's a simple test that takes about 3 minutes and can identify whether your blood pressure medications are putting you at risk for falls. It's called orthostatic vital sign measurement, and most doctors aren't doing it routinely. Let me teach you how to do this test at home tonight because this information is potentially life-saving. You need a home blood pressure monitor. They're available at any pharmacy for about $30. Here's the protocol. Lie down flat on your bed or couch for 5 minutes. Just rest. After 5 minutes, check your blood pressure while still lying down. Write down both numbers. Now stand up and immediately check your blood pressure again while standing. Don't wait. Check it right away. Write down those numbers. Now compare them. If your systolic blood pressure dropped by more than 20 points or if your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is a red flag. This means your blood pressure medications may be too strong for you, or your target blood pressure may be too low for your physiology. So what should your blood pressure actually be? I'm going to give you the ranges that research suggests are associated with the best outcomes for different age groups, but understand these are guidelines, not absolute rules. Your individual target should be determined in collaboration with your doctor based on your complete medical picture. For adults age 65 to 74 who are generally healthy and active, research suggests a systolic blood pressure range of 130 to 140 is reasonable. This provides cardiovascular protection while maintaining adequate perfusion to organs. For adults age 75 to 84 who are relatively healthy, the evidence supports a systolic range of 135 to 145. Notice this is higher than the younger group. This accounts for increased arterial stiffness and slower baroreceptor responses. For adults over 85 or for those who are frail regardless of age, a systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and maintaining quality of life often takes priority over aggressive blood pressure lowering. If this information resonates with you, I need you to do something right now. Share this video with someone you love who's over 70 and on blood pressure medications. This could prevent a fall that changes their life forever. And make sure you're subscribed because I'm going to show you the 5-minute morning routine that naturally supports healthy blood pressure without medications. The pharmaceutical companies don't want you to know about this, but it's backed by solid research. Hit that notification bell so you don't miss it. Your independence might depend on it.